struggle with obesity. That's according to the CDC. Dr. Christopher McGowan, an obesity medicine specialist, is here with what we need to know. Welcome back, doctor. Thanks for joining us.
Hi, Hena. Thanks for having me back.
Of course. So we're hearing a lot about those shortages when it comes to drugs like Wegovy and Ozempic. Have those eased up enough that people can count on getting the medications as they go into the summer?
Everybody's interested in these medications. They're really effective, but they're incredibly difficult to obtain, and that really has not yet changed. That's the single greatest barrier for patients who are trying to obtain them. They're just not readily available because of the immense demand.
So with these weight loss medications, it causes people to lose their appetite. So obviously they eat less. Are there nutrients that they should be getting, should be eating, should make sure they intake when they're on these medications?
Absolutely. Like we talked about last week, nutrition is really the foundation of any weight loss treatment, any weight loss journey, and it's no exception with medications. Now, these medicines are so effective at reducing appetite that you may not be that interested in eating. You may undereat, and in fact, there may be side effects such as nausea that might prevent you from eating certain foods. So we really have to make sure we optimize every single calorie, and protein needs to be the focus. So 60 to 90 grams of protein per day is essential. We don't want to just waste away. We're trying to lose weight in the healthiest, most sustainable fashion. And whenever possible, work with a registered dietitian.
Always good advice. A lot of studies that have been keeping an eye on these long-term use of drugs say staying on it is necessary. But is gradual tapering an option? Will that prevent weight regain?
Yeah, so the single greatest limitation of these medications is that when you stop them, you're likely to regain the weight. And that's just the reality. Now, there was a small study that showed that some patients who tapered their medication over about 2 months, rather than stopping it abruptly, while continuing to exercise and work with a health coach, were able to maintain their weight loss. But this is a really small study and really does not change the reality, which is that the vast majority of patients who stop a medication will regain the weight. So instead of focusing on strategies to get off of medicines, we should be focusing on strategies to stay on them.
So let's talk about that. What do you suggest to help people maintain their weight loss?
Yeah, again, the single best strategy is to stay on the medications. So these are long-term treatments. We know from studies that about 2/3 of the weight that you lose will be regained within a year of stopping the medication. And this is high quality clinical data. So we need to ensure we stay on the medicines. The reason this occurs is very simple. The medicines only work when you're taking them. They're really effective at reducing hunger. They turn down that thermostat. But as soon as you stop the medication, that furnace fires right back up and you're likely to regain the weight. So the goal here is to stay on the medicine once you start it, and to work closely with your medical team so that we can ensure that you're doing everything possible to stay on it.
And we know these drugs are meant to be injected. Some people have a fear of needles or just don't want to take a weekly shot. Are there oral options?
Yeah, not yet for the treatment of weight and obesity. Everything currently is in an injectable form, and that may be a barrier for some patients, though for most people it's not that big of a deal. But there are newer treatments coming in the medication realm in terms of oral versions. They are coming down the line. And keep in mind, there are many other treatment options. It's not just limited to medications. Bariatric surgery is still the most effective treatment overall, and that may be an option for someone. And there is also this new array of treatments in the endoscopic realm. These are minimally invasive, non-surgical treatments that can provide lasting benefits without all the risks. The point is, there are plenty of options. There's no shame in reaching out for help, so contact an expert if you need it.
Doctor, we're running out of time. I want to ask you one more question about side effects. You mentioned nausea just being one of them. If you're on a drug and you may feel it's not right for you, is it possible to switch to another weight loss medication?
Yes, switching between medicines is something that's commonly occurring right now, mostly because of supply disruptions and back orders. And so this is something that can be done. There isn't an established path or framework to do it. But if someone is unable to obtain Wegovy, for instance, we may need to switch to Zepbound. But if you're not tolerating one of these medicines, if you're having significant side effects, you're likely to have them with any of the other medicines within this class. So again, work with an obesity specialist. We can help you mitigate a lot of the side effects. And if you just can't tolerate it, it may not be right for you.
Thank you for shedding light on such a popular topic. Dr. Christopher McGowan, I really enjoy our conversations. Thank you, sir.